So I do want to jump into the time of COVID. I feel like we're COVID. I said this last week, and I probably say it on a daily basis. Every subject line in my inbox these days seems to have COVID, in it somewhere. But it is our reality. I don't want to take away from the very real fact that we've got patients out there living with lung cancer who still want access to their treatments, and whether it be, their chemotherapy or their follow-up scans or their palliative care visits. So in the time of COVID, how might patients be able to either continue and or initiate palliative care services? And is it also that full assessment for the patient and the caregiver during this time as well?
None of us have lived through anything like this before. And for people with illness, I think it just increases the social isolation of already living with a serious illness. It's interesting, though. I would say that for many of my patients, they're far more resilient than maybe even we are, because they've already coped with so many challenges in their life. They've already coped with neutropenic fever or having to isolate themselves from loved ones. And so there's a lot of strength in having gone through cancer treatment and having gone through a diagnosis of cancer that really gives them strength as they face this pandemic as well. I would say that now with COVID, for palliative medicine, we're busier than ever. I was just in clinic yesterday and I saw 15 patients. I interestingly wore my scrubs, wore my face mask, wore my white coat, and went to clinic and sat in my clinic room and looked at patients on the screen all day long. So I Zoom or video visit every patient, and we do everything virtually. We do all of our assessments as much as we can virtually. We don't get as much of the team visit in place because the technology hasn't allowed it quite yet, but we're working on it so that we can have multiple providers at the same time. But right now, we can provide excellent symptom care, excellent psychosocial care by telehealth. And it's interesting, a lot of what we do is talk to patients. It's a little bit less about physical exam and labs and radiology studies. So our skill is really in the communication, and our skill is really in understanding patients' wishes, goals, and experience. And so that can definitely be done through a telemedicine visit. For many of our patients who are frail or sick, who are struggling with mobility, or who just hate Bay Area traffic, which I would be one of those folks, they are thrilled. They're like, man, this is so much better than, trying to schlep my way to Stanford on a regular basis and valet park my car for $16 and, wait in, the waiting room for an hour. Like, I am glad that when it's my time, you log on, I have my cup of tea, and I can talk to you about the things that are most important to me. And so there's a silver lining in the COVID piece where I like to see people in their homes, and I like to see what they like to eat. And I like to see, where their caregiver is puttering around in the background. And I like to see the dog jump on their lap or the kid jump on their lap. And so it's something's really beautiful. It's almost like a home visit in the days of home visits,
Mm-hmm.
to really take care of people. And it's really removed some barriers. We have people from Turlock and Atwater and Pismo Beach, and people who normally wouldn't make an extra visit for palliative care because they think of it as an additional service, who are now like, yeah, sure, why not? I'll get on another Zoom call. And so it actually has reduced some of the barriers to care and made people much more willing to give us a shot to really see how we can help and assist them. And it's been great. So I wish I could see them. I wish I could give them a hug. I'm a hugger. So it kind of sucks to not be able to do that. But it's, I feel like to be able to at least still see people, and sometimes every week. There's some people I'm like, okay, let's talk again next week. Let's talk again next week, because their pain's not well controlled, or they have depression that's really hard, or they're, working through an advanced care planning document, and they're, talking to each family member in turn. And so it's been great because I can even see people more often than I used to.